Well, good afternoon, everybody. Thank you for being here today with us. It's a pleasure to be here this afternoon with my friend, Dr. Sayi Zilke, to provide an update on Alberta's healthcare's refocusing and how we will be improving continuing care in our province. In October of 2023, Premier Danielle Smith and Minister of Health Adriana LaGrange announced healthcare refocusing in Alberta. This is an effort to fix Alberta's healthcare system to ensure Albertans can access healthcare that they need, when and where they need it. As part of refocusing of our healthcare system, we are focusing on creating four different priority sectors: primary care, acute care, mental health and addiction, and continuing care. In the fall, Premier Smith appointed me as the sector minister responsible for continuing care. This means underneath my leadership as sector minister and underneath the Ministry of Seniors, Community and Social Services that we will be overseeing the assisted living system. This includes continuing care, home care, community care, non-medical supports, and operation and capital in those areas. Since that announcement, we have been working diligently to transition these services over to the new department in preparation for today's announcement. Alberta is growing at an unprecedented rate, and as our population expands, we are seeing greater demand for health services and supports. In addition to this growth, our population is also aging. Right now, we have a little over 800,000 seniors in our province, and about 2,500 more Albertans turn 65 each month. And by 2046, 1 in 5 Albertans will be 65 years of age or older. And because of this, over the next 10 years, demands for continuing care services in Alberta is projected to grow by 80%. This is increasing even faster as people live longer and with more complex needs. As our community changes, it's important that older adults, people with disabilities, and Albertans experiencing homelessness and other vulnerable populations have access to the support they need to maintain their quality of life and to live and age with dignity. Right now, we are experiencing challenges within our continuing care system that requires our immediate attention. Recent federal studies show that 75% of Albertans enter the continuing care system through acute care, through emergency care, well above the national average. We can continue to have Albertans waiting in hospital for continuing care services, but it just will not work any longer. Albertans deserve to age in a setting that meets their needs, and this includes enhancing our home and community services, expediting space availability, and making sure Albertans and their caregivers are well informed. There are inefficiencies that our government will be addressing. As you know, the Alberta government is committed to refocusing the healthcare system to better serve Albertans and frontline workers who provide care within that system. Part of this commitment includes providing seniors and people with disabilities and other vulnerable Albertans with the support and services that they need. As part of this work, I'm thrilled to unveil the name and the logo of Alberta's new provincial health agency that will be dedicated to changing how we define and deliver continuing care services in our province going forward. Assisted Living Alberta will offer Albertans access to a full range of wraparound services from medical and non-medical supports, home care and community supports, to housing and social services and other supports. Through Assisted Living Alberta, we will prioritize addressing a person's complex needs of care rather than focusing on simply providing medical care for a particular diagnosis. Assisted Living Alberta will bring together the medical care that Albertans rely on with the power of the social service organizations and nonprofits that provide support to create true wraparound services based on the needs of each Albertan. Assisted Living Alberta will be built on partnerships with the many nonprofits, support agencies, and healthcare providers to ensure that Albertans can access all of these supports all in one place. Letting Albertans focus on getting to the care they need instead of navigating a complicated system is our focus. We are moving very quickly to establish Assisted Living Alberta alongside the 3 other provincial health agencies, and today I'm announced that ALA will have a legal start date of April 1st, 2025, and be operational later this year. Now, in order to transform a system, we need to rely on our partners and subject matter experts to get this right. And that's why I have established an Assisted Living Alberta Transition Committee. The chair of this committee is Dr. Sayi Zilke, who is a cardiologist and a medical director at Chinook Cardiology. Dr. Zilke is not only an expert in the field of cardiac care, she is also a fierce advocate for the needs of patients as well as promoting wellness in our communities, which makes her a great leader for this work. In addition to Dr. Zilke This committee is made up of leaders from the assisted living areas, from healthcare, from the social services sector, and we will lean on their expertise to guide our work in the coming months. We will also be collaborating with healthcare and social services professionals and staff and other organizations as we learn from their expertise. We want to hear from Albertans who are experiencing the system firsthand and from frontline care providers. To start, today we are launching online engagement at alberta.ca/lead the way. This will give Albertans a chance to provide their feedback on how we can build a better assisted living system. We will also be providing a survey to gather feedback from continuing care providers, as well as those working within the system. I encourage everyone who is interested in this important issue and has a stake in the system to take the time to share their feedback. The survey is open until March 3rd, and we want to hear from you. In addition, the advisory committee will be conducting ongoing roundtables with continuing care providers in the coming weeks and months to build on the overall ongoing consultation that we have taking place all across the province between all three ministries in charge of the healthcare system. This is a big process, and we are going to take the time to get it right. Our goal is to establish this agency this spring on April 1st. Until then, things will be the status quo, and we will ensure there are no disruptions to critical services. Almost all of us will need assistance at some point in our lives, and I want to make sure that we have a system that truly puts Albertans first. I'm excited about this opportunity to provide true wraparound services to Albertans through this refocused healthcare system. And with the establishment of Assisted Living Alberta, I'm very confident that we're going to be able to meet those goals. And with that, I would like to introduce to you the chair of our Transition Committee for Assisted Living Alberta, Dr. Sayi-Zilke.
Thank you, Minister. I'm truly honored to be playing a role in helping transform Alberta's continuing care system and to be working with an incredible team as part of the Transition Committee. This is our opportunity to transform, integrate, and elevate the care that we provide to our community within the continuing care sector. But we cannot do it alone, and that is why we want to hear from our fellow Albertans. You can, and we want you to, be part of this positive transformation. Please have your voice heard by filling the engagement survey with the links available on the Government of Alberta website. To my healthcare workers and the frontline workers within the sector who are working tirelessly within the system to provide the best care possible to our patients and to our clients, this is our chance to design a system that truly puts the patients first and provide world-class care to our community. I sincerely urge all of you to fully engage and take a few moments to fill out the survey. Your feedback is so valued and will help shape and transform the continuing care that we provide in our communities. Thank you for your consideration and your support, and thank you again, Minister, for the opportunity and the privilege to be involved in such an exciting and transformative endeavor. Thank you.
That concludes the formal portion of our announcement today, and we're going to move to Q&A from media. If there's anyone in the room who would like to ask a question, I ask that you just please go up to the microphone. And please state your name and outlet for the record. First person, go ahead.
All right, it's Alicia Fieldberg with CTV News. I just want to know more about what this Assisted Living Transition Committee does.
Well, we're working on a process as we break the health care system into 4 different health agencies. That's pretty significant. So, for example, Assisted Living Alberta will be taking on the leadership of 19% of the current healthcare system. Which is, in government speak pretty significant as far as obviously budget space, but more importantly, as far as the services that are being provided. And so it's very important that as we do that work, that we recognize that we have to do 2 things. First is to make sure that we continue to run the system that we already have, which is now being done through the Assistant Deputy Minister of Continuing Care in my ministry, to make sure that that we're going forward, we're caring for tens of thousands of Albertans who are depending on that system, and that we know that that system is continuing to be run safely, effectively as possible while we go through this transition process. And at the same time, we need to be able to bring a group of people together that can look at the system in its entirety. One of the things that the Premier wants us to really focus on is to not just have this as a healthcare conversation, but a true conversation about assisting people who have to live outside of a healthcare system or a healthcare setting in a community in some way, but still require healthcare services, but other services. We strongly feel that a lot of the other services have been lost in that conversation, and we need to bring everybody together around the table to be able to make sure that we're effectively coming up with a long-term plan and vision, and then executing that plan and vision to be able to meet that objective of true wraparound service in the space. And so people that are on that committee with Dr. Zielke include obviously people from the continuing care sector, the traditional healthcare side of that, but also people from housing, people from my department when it comes to seniors care, people that are disability advocates, which, you know, is a sector that we think has been lost at times in this conversation when it comes to continuing care. Homelessness, which we see as a significant conversation also in this space that will be around that table. And so that group coming together is working in real time, meeting regularly, and feeding right into our process as we transition to this new organization. And as the doctor said, this is a unique opportunity that I think that we have here in this province. You don't see this level of change taking place all the time, and it's really critical that we get this right and that we can make sure that we leave a system behind that will be able to care for Albertans for many decades to come. And I don't think we can do that just with government support. We need those who are working on the front lines, those who are working in organizations in leadership roles to be at the table for this. So that's what the Transition Committee is doing. I don't know, Doctor, if you want to add anything to that as the chair? No? Okay.
Thank you. Do you have a follow-up?
Yeah, just as a follow-up, you discussed how the new system is meant to be less complicated. Can you describe how it will be more streamlined, less complicated?
Well, there's going to be a real focus on innovation and technology. Some of the earliest work that we're doing right now is around technology. And I can tell you, I spent the last couple of months since being appointed to this role, spending a lot of time with sector leadership and organizations that are working in this space. And the one thing there's many other things we hear, but one thing for sure every meeting is the need to really focus on innovation and technology. And so we'll be, the Premier uses the word Uberization. She's not talking about privatization when she says that. What she's referring to is ease of use within the system. And some of the early things that we're going to have to focus on in that space is how we make sure technology is communicating between different ministries, different organizations, that we're showing stuff like, spaces that are available. That's not communicated in a central way. And if a family is interacting with the system right now, they can't actually see what's available. I can't see currently as a minister what's available. That's an extraordinary challenge. So those will be some of the early aspects of this. But at the end of the day, what we want to make sure is that we're getting the most innovative technology here to care for people within the system and making sure that people are in the right spot. And to do that, we have to be able to put in a system that makes it easy to use for both people that are receiving care and continuing care, but people that are also working within healthcare or other aspects of the social services sector to be able to bring that care together.
Okay, thank you.
Sarah Offen from Global News. Thank you for taking my question, Minister. I wanted to ask you specifically about changes that we saw at some facilities over the pandemic, but in particular at Care West Colonel Belcher, where patients and families have since reported a significant decline in some of the care that they're receiving, targeting specifically the commingling model that was brought in. Can you speak to whether that commingling model is going to be part of what you see as the future of continuing care in Alberta, and why or why not?
Well, I've met with the Friends of Colonel Belcher just recently. The things that I've been hearing that were taking place specifically in Colonel Belcher concerned me. They alarmed me, which is why I met with them. I've been having conversations with the department as we take over this month. We took over officially on January 1st to go in and have a real deep dive into what's taken place there. In the short term, though, I've instructed the Assistant Deputy Minister of Continuing Care to take steps immediately to care specifically for the people in that facility, to then create some space for us to have the co-mingling conversation in a more comprehensive way. The reality is that I do think that there will be some level of commingling within the system that we will need. I don't think there's any way forward for that to take place, but it has to be done right. And I've been in facilities where it is done right, and it's going well for everybody that's involved. And clearly, based on the stories we're hearing from Colonel Belcher, that is not the case. And so I know that the Assistant Deputy Minister of Continuing Care will have more to say specifically about the short-term plan for the Colonel Belcher, and I look forward to that. And then I just want to create space to then have that longer-term policy conversation in a more effective way when we know people are all safe, and then we can sit down and figure out the best way forward that, again, allows safe community. And that's what we're trying to build. And I also want to stress, I think that's a big difference between what we can do in my ministry versus what healthcare can do. Healthcare already has such a huge job running that acute care system and primary care. They don't have time to figure out how to build community. What my ministry does, and the reason we brought continuing care here, is that's what we do. It's not just about the services that are provided there. We recognize that we're building a community for people to live in, to call home, where they may be receiving services for the rest of their life. So we'll have more to say about Colonel Belcher. I share the concerns, and I look forward to having that conversation.
Just to follow up then, the Minister of Health had previously promised an investigation. Is that report then being taken over by your ministry, and when can we expect to see or hear more from that?
So, well, first I'll take the investigation. The investigation is done. It's complete. The report is sitting on the current Minister of Health's desk, and I have to refer you to them on when they're going to release it. This is one of those areas where transition, of course, is taking place. There would probably, in the future, if this happens now in the new way that things are set up, there would be aspects of that investigation that would have fallen under my department, particularly around policy decisions around commingling and whether or not that makes sense for the system. But going forward, we've also kept the licensing aspects of continuing care in the Department of Health. For maybe a best description of what that looks like, I often use is referring you to like health inspectors going into restaurants, right? They're not running the restaurant, but they're making sure that the health rules around restaurants are being run. And we're going to structure it like that. In fact, the continuing care licensing inspectors will be in the same division that does that type of inspections. So some of that investigation would have overlapped with that role that health will still be responsible for. Some would overlap with us. Because of where it was at, it's under the current leadership of Minister LaGrange. I know that she's working diligently to release it. She'd probably have more to say if she was up here. What I can tell you, though, is, again, to my earlier point, I've instructed our Assistant Deputy Minister not to wait for the results of that investigation, but to move forward with making sure people at Colonel Belcher are safe, and then setting up a very comprehensive way to have that conversation about commingling in a calm way, in an effective way, I think, to be able to care for the people that we want to care for.
Lauren with Radio Canada. So there is fear that, you know, it's a separate ministry, it's a new agency, and people want to make sure, especially for elderly, they're not necessarily going to not need acute care or primary care. So how can you reassure, do you have a plan in place already for April 1st on how there's going to be communication and transition between acute care, primary care, and then assisted living, or is that something you're going to figure out as you go? No.
Well, the first thing I want to be is very clear to Albertans that for the entire health refocusing, nothing changes for how they interact with the healthcare system. If you are having an emergency right now, call 911, get an ambulance, go to the hospital. If you need to go to your family doctor, go to your family doctor. And if that means that you're then heading towards some type of different primary or acute and or continuing care service, that will still be your connection into the system. And so for Albertans right now, they will receive health care no matter where they are within the system. These 4 health organizations will work together simultaneously. What changes is we no longer have one health agency trying to deal with all of these issues at once from a leadership perspective. We will have agreements on how we work together between all of those organizations. They're going to have to work together very closely, but the leadership of this organization will be focused on making sure that the people that we're responsible for are, one, receiving the services that they need in a timely manner, second, receiving it in the areas of the province that they call home and that they need those services from, and then third, receiving it in the appropriate facility. And so that's where our focus will be. If somebody in a continuing care facility is in an emergency situation, they're still going to be cared for by acute care doctors. They may be going to the emergency room, it may be paramedics that are interacting with them. They are still obviously going to be working with their primary care physician. None of that changes. These organizations are going to be very capable of working together.
All right, and there's also been conversation about having small home care. Is that part of your plan in this new agency, Assisted Living Alberta?
Innovation in all aspects, including capital, is a top priority for this conversation. The circumstances are changing in the housing industry, never mind just continuing care. My ministry leads that as well. We are also the ministry that leads the development of senior care homes, which is the primary capital infrastructure that we'd be investing in caring for seniors. And so the process for continuing care capital will merge with that division because they're the best ones to work at this. And new types of technology, including small homes or different ways to be able to build projects, is what we've been focused on when it comes to tackling the housing crisis that we see in Canada. And it will be no different for continuing care. There will be levels of different need within the build itself, for sure, but all of these aspects have to be on the table. I mean, the reality is that the way that we cared for seniors will not be acceptable in the future. We're just changing. Also, one of the biggest challenges that I see is around communities that I represent. I represent 34 towns and counties in rural Alberta. The only way forward for some of the challenges that we see in those communities is more small home models, more group home models. One other point I would add to that is that's work that we actually already do in our department when it comes to people with disabilities. We do a lot of that small home type of project work. And I think that what we've learned through that process is going to really help with some of the work that we bring in to do that in continuing care going forward.
Thank you.
Thank you, operator. Can you please put through the first caller?
The first question is from Dennis Crofton from CBC Fort McMurray. Please go ahead.
Minister Nixon, yesterday the municipality of Wood Buffalo said they purchased a plot of land next to the continuing care facility in downtown Fort McMurray, and they want to build an aging-in-place facility there, and they say it's part of the municipality's strategy to keep pace with the increasing aged population here. What do you think of this?
We're going to have to continue to invest significantly in capital in all the affordable housing space, but particularly in the senior space. The numbers that I introduced in my opening comments of 2,500 more seniors a month in our province is a pretty significant number. Feeding that already into the highest population growth in the country and an already existing housing crisis that really amplifies the challenges that we face. So anywhere where we can get capital projects being built in creative ways is important to us, but particularly where we can see partnerships between the province, the municipality, and the federal government, which is what you're referring to. So we support that direction. Obviously, the projects have to work for individual communities, which is why we work with them to figure out what is best for their community. So in general, definitely support it. I do want to also stress, though, and we're having some of these conversations with municipalities right now, that we're not going to be able to build our way out of all of this. So building has to be part of it. Capital and large facilities have to be part of this conversation. But we have to start to introduce in this conversation in communities all across the province how we're going to do builds sometimes differently. We just had a question on smaller homes or smaller type of models. That has to be a conversation that needs to be at the table. And there also has to be significant investment simultaneously in helping seniors and others remain at home as long as possible, as long as they want to be there and it's safe for them to be there, because sometimes that is going to be the better option. And the reality is we can only build so fast.
Dennis, do you have a follow-up?
Yes, I do have a follow-up. When it comes to the work of the agency that you are heading, can you describe what is the provincial strategy for seniors to, as you said, age in place, remain in their homes for perhaps longer, and receive necessary services for that, including in northern places such as Wood Buffalo, Fort McMurray?
Our objective with the continuing care organization, with Assisted Living Alberta, is to make sure that everybody receives care and is able to live where they need to be. Right now in our system we have people who need some level of care that are in the wrong spot. So our first objective is to make sure that we have people in the right spots to be able to receive the best care that they can. Our second objective is to recognize that this is beyond just a healthcare conversation. Healthcare is important for this conversation, but the vast majority of the needs for the population that we're speaking about is well beyond healthcare. And so by bringing this into one organization that can focus on that entire wraparound approach, bring the entire power of the social services division of government, but more importantly, the thousands of nonprofits that work side by side with us each month to bear on problems. We can provide all those services at once. Also, I think this may be what you're alluding to. We have to make sure that investments that already exist within government or that are needed by government to be able to make sure that individuals can remain at home at times where there may need to be minor investments such as upgrades to washrooms or ramps that might have to go into a home or things like that are looked at first before we take drastic actions and have somebody have to leave the home and or community that they want to be in and go into a facility just because of something that was probably significantly cheaper for the taxpayer and ultimately better for the individual needs to be invested in before we look at permanent facility type of spaces for those individuals.
Thank you. Operator, can you please put through the next caller?
The next question is from Catherine Gradkowski from Alberta Today. Please go ahead.
Yeah, thanks for taking my question. So you mentioned right now there's a mix of nonprofit and private and public, and your ministry doesn't have oversight of everything in the wait list. So can you explain what would change, for example, for a private operator now that this agency is coming into effect?
Well, private operator will, when this is finished, work for Assisted Living Alberta. Currently, right now, they would work for a combination of the Department of Health and or Alberta Health Services. They would work for Assisted Living Alberta. Their contract would be with them. We would be driving the overall direction of continuing care. The only thing that would remain in day-to-day operation in health, I don't want to confuse anybody, would be making sure that a facility and our operation is meeting licensing requirements. And so, again, the example I just used that I think best illustrates that would be no different than health inspectors checking on restaurants to make sure they're meeting health code as far as those restaurants. We would not enter into a contract with a facility that did not have a health license that said that they met those standards. But other than that, the operation of the entire system will fall underneath Assisted Living Alberta. That's going to take obviously months to transition fully, but that is a pretty significant change as far as structure.
Catherine, do you have a follow-up?
Yeah, and I'm wondering, there's been some discussion about navigation of all these different agencies. So sometimes one of these facilities may have something to do with Recovery Alberta and mental health. Sometimes there are continuing care centers that are in acute care. So if somebody has concerns or questions about assisted living, who do they report to, or who will they be asking questions?
Assisted Living Alberta going forward. And, we already do this in other aspects of the system. This is actually not complicated. So, for example, right now in all our homeless shelters across this province or in our navigation centers working with homelessness, primary care is working side by side with our workers to be able to care for people. Mental health and addictions has staff working side by side with our people. I have social workers working side by side with police officers from different law enforcement divisions. We can do this as a government. This is actually what we do in my department almost each and every day to be able to work with other ministries to be able to provide support to individuals. So that aspect of this, I don't find that complicated. I think that Albertans will not see any significant change as a result of that role, other than a more specific focus to be able to make sure that continuing care services are appropriate for individuals that need them.
Thank you. Operator, can you please put through the next caller?
There are no further questions at this time. Please proceed.
That will conclude our conference. Thank you, everyone.